To get sickle cell disease under control, there are two important things that need to be done. First of all, prevention. To prevent complications, you must drink lots of fluids to minimize red blood cell clotting, take antibiotics, phenethicillin, Broxil, until you turn 12 to prevent infections, take folic acid to boost blood production, eat healthy and enough for optimal growth, and ensure sufficient iron, folic acid, and vitamin B12 intake. And you will have extra vaccinations against conditions such as pneumococcal infections and the flu, regular dental checks to prevent infections. Every year your blood will be screened, and your liver, kidneys and spleen will be checked for damage. And you will have a brain scan once or twice a year to check whether the blood vessels in your brain are still letting enough blood through. If you have severe anemia, your heart will also be examined regularly, as will your eyes. And if you have severe abdominal pains, you will be checked for gallstones. Aside from that, you will be told exactly when you should go to see your doctor in case of medical problems. And then there is the treatment of pain and other symptoms. A gradual onset of pain due to a sickle cell crisis is something you can treat yourself by drinking lots of fluids and taking painkillers. Paracetamol, sometimes with codeine, possibly alternated with diclofenac. Staying warm, resting, and even a massage will also help. If the pain or other symptoms do not lessen, go to the hospital to have fluids administered intravenously and for extra pain relief. You may also need fever treatment or extra oxygen or antibiotics. In particularly severe cases of sickle cell disease, doctors may prescribe medication such as hydroxycarbamide, Hydrea, or you may need blood transfusions or exchange transfusions. If such measures do not help alleviate the signs and symptoms, a stem cell or bone marrow transplant may be considered. If you have regular sickle cell crisis or severe complications, you may be prescribed hydroxycarbamide. Hydroxycarbamide inhibits blood production in the bone marrow, triggering the bone marrow to produce HbF, fetal hemoglobin, again instead of HbS. It also suppresses the production of other blood cells to prevent your blood vessels from clogging up. It also makes that red blood cells do not clot together and stick to the vascular wall so easily, reducing the chance of crisis. The hemoglobin in red blood cells is mainly made up of 2 alpha globin chains and 2 beta globin chains. This is hemoglobin A1. In cases of sickle cell disease, the beta globin chain is abnormal, and the body produces hemoglobin S, which allows sickle cells to form. Your body also produces small quantities of other kinds of hemoglobin. 2% of hemoglobin A2, which is made up of 2 alpha globin chains and 2 delta globin chains, and 1% of hemoglobin F, which is fetal hemoglobin and made up of 2 alpha globin and 2 gamma globin chains. Hydroxycarbamide increases fetal hemoglobin HbF production, meaning that there will be more normal red blood cells with HbF, and therefore without HbS, that do not turn into a sickle shape.